before I forget. Thank you so much. Since I started this position with the Historical Society in the middle of March, at the very beginning of the pandemic really affecting Connecticut, we've at the Historical Society been very aware that we're living through historic times, and we don't always want to be living through historic times, but we didn't get a choice in that matter. So that reminds us of the saying that that it's a curse to say that you should live in interesting times. So here we are. Like many other history organizations across the United States and really across the world, we've been interested in trying to document what it's like what the experiences that we've all been living through and how we've been adapting, what the challenges have been, what some of the silver linings have been. And we thought it would be a great opportunity to bring together some people who have been responsible for leading some of the organizations of the Jewish community here in the greater Hartford region through this crisis since March, and now it's been about 7 months. And maybe also with just having gone through the high holiday season and experienced what that was like for our synagogue leadership, as well as for us as individual worshipers and so on, that this might be a good time 7 months in to sort of reflect on what this has been like and what the adaptations that we're making and what some of the long-term changes that we might anticipate coming out of this might be in the long run, though none of us, of course, knows, because that's the thing about living through history. So really briefly, I just wanted to show you, if I can, this is one of many projects that different history organizations have put together of people that are trying to collect and document everything from photographs to diaries to physical objects like masks and things like that. And this is actually a map of one big project, and every dot you see there is a particular object that has been submitted to this site to document somebody's experience of COVID. So if we zero in here a little bit and get a little closer to Connecticut, we can see that there's, in the Hartford area, these objects have been submitted to this particular site. So let me get a little bit closer in here. I have no idea what this is actually, but I'll show you what I get. So this is an email that somebody received, and I can't, from CCSU. So so the whole site consists of multiple different kinds of things that people have submitted to, to document the experience of the pandemic. So we at the Jewish Historical Society are interested in documenting the experience of our regional community here and thinking about what the impact of COVID has been on on the life of the Jewish community. So, so we've got a great panel of people to speak to you about that tonight. And we're going to start, as seems very appropriate, from the experience of medical staff. So Dr. Anat Bergner is going to tell us a little bit about what it was like being a doctor working in a hospital during the medical crisis, especially earlier this year. Anat is a hospitalist at Hartford Hospital, and she specializes in internal medicine and has previously worked at UConn Hospital. So I'm going to turn it over to Anat. Anat, I think you're still muted.
Yeah, sorry about that. So, yeah, I mean, it's been quite a journey since the beginning of this pandemic, and my and other physicians' approach and engagement with this virus. It started with just abject fear, mostly before we ever took care of patients, because I know for myself, I was consuming nothing but COVID for several weeks before we got it in Connecticut. So we were all watching what was going on in Italy and hearing the awful news there, stories coming out of Italy, and then getting reports out of Seattle before, and then New York before we really got it in Connecticut. So we were just kind of waiting for this big wave to hit us. And myself, I was really scared. And I think mainly just because of this constant consumption of COVID news that I was just not able to turn it off at all. I could not stop reading about, looking at the statistics, looking at the numbers, and nothing else interested me. I couldn't read about anything else. The rest of life just stopped. It was all COVID all the time. So that right before I started having my own COVID patients, I had a little bit of a breakdown myself. I just got really scared. And there was a period of about 2 days where I just kept crying. I was really nervous that I would die and leave my kids without a mom. And thankfully at that point I was at UConn, and I had some wonderful colleagues. I mean, I do now as well at Hartford Hospital, but, and I had to rearrange my schedule a little bit. So I kind of moved things around, and I was able to give myself a few days off just to kind of regroup. And then I started, and it was very scary at the beginning, being in the hospital, because you just didn't know how long you were going to have masks for. The masks going to run. At that time, we didn't know when our PPE was, and the news was crazy because we were told you're not allowed to reuse them, but we're going to run out in 2 weeks. And so there was and this was guidance from the CDC. So even back then, it didn't make sense. Like, we already had to scrap our N95s when we knew we were going to be completely out in 2 weeks. And so it was just like, it just felt like nobody knew what to do. And it was also very scary to be in the hospital, because you would hear overhead pages all day long, anesthesia stat. And 5 minutes later, anesthesia stat to another room, anesthesia stat to the ED, anesthesia stat to room 303. And you knew who was in room 303 because you just admitted them. And then all of a sudden you're like, what just happened? So it was left and right, constantly, emergencies overhead. So it was just a very scary, and, because we just didn't know what was, and so for me, initially coming to see my very first COVID patient, I was very hesitant, and I must sort of look back on it and kind of cringe, and that I just kept my distance. I was scared, and I was in the room with the patient, and when he coughed, even if it had nothing to do with COVID, because he drank some water and started coughing, and I just kind of pulled back, and I knew, I saw myself doing it, and with each next patient, and after, the next one and the next one, it just got normalized, and after a while it just was like the fear went away. And it was still very difficult to contend with the way we were delivering medicine, which was so antithetical to what we were doing before. You're unable to really get close and talk, touch your patient and spend a lot of time and make meaningful contact. Everything is just through all these masks and face shields, and it just didn't feel like the kind of medicine, that we were providing before. And that was also very, it was very upsetting. Just not knowing what we were doing. Are we using hydroxychloroquine? Are we not using hydroxychloroquine? Are we checking these labs? Are we not checking these labs? Can the person have a CAT scan? Can they not have a CAT scan? Who's going to do, this procedure? They need a procedure, but they can't, and just not knowing. And then the worst thing was not knowing who was going to get sick, because like I said, you heard these overhead pages left and right, and it was one person that wasn't really that sick, and then all of a sudden they got really sick, and you just had that sense of impending doom. Eventually, you started to see somewhat of a pattern, and you started to recognize people who were might get sick on you. And so just like with anything, you start to know it better, and you start to be, and then managing it, the fear of it becomes, easier, because it's less, we still don't know a lot, but we know a lot more now. And so that was our experience. We weren't able to spend as much time with our patients as we'd like, but then we did get to spend a lot of time on the phone with family members. And that was meaningful. And so I got more meaning out of that, because I didn't get the same level of meaning and contact and connection with my patients as I had before. But I did with talking to family members who couldn't come and see patients. And that was also hard, because some of them were dying, and the families couldn't come, and that was really hard for them. And then, hard for us as well. But it just started getting easier with time and with taking care of more and more patients. So the unknown part of it, at least in large part, that part evaporated. And now it's kind of, it's funny, because at the beginning when we would go in, I spent, 10 minutes getting my gown and gloves and mask and shield, and everything was just so, checking the mirror to make sure, it was all done correctly. And, now when I go into a room, it's the quickest thing, just put it on, get in there, and, not spending 10 minutes thinking, how am I going to take this off without getting contaminating myself? And, because that was another project, taking everything off. So now it's just old hat, unfortunately.
Great. Thank you, Annette. That's really important to hear. I should say we're going to allow each of the panelists to speak for a few minutes, and then we'll have some time for questions. So if you want to ask more questions of what it's like now, or what they're anticipating in the next couple months, we should have some time for that. I'm going to turn now to Rabbi Tuvia Brander, who's going to speak about some of the challenges faced by synagogues and rabbinic leadership in the community during this time. He's the leader of the Young Israel of West Hartford, and also was serving as president of the Greater Hartford Rabbinical Association during this time. And as many of you know, he's also active in several different organizations within the Jewish community, including Federation. And please, Rabbi Brander.
Thank you. Thank you for hosting this and putting this together. And thank you to it's an honor to be on with such esteemed panelists, many of whom I speak to on such a regular basis. So it's great to be here with you. And it's given me an opportunity to kind of think back and reread some of our communications from March. And I guess I want to start and open with two thoughts on that. And you'll excuse the sports analogy for anyone who's not a sports fan. There's an expression in sports that you're a rookie until your first off season. And that when you're in it, it doesn't matter how many games you played, you're still a rookie until you have that time where you can step away from it totally, look back and assess. And I think the reality is that we're still very much in it. And while this is good for us to kind of get some distance and get back in, we're still very much in it, and we still need to be, as vigilant as we were in March, to continue to make sure we do everything we can to make sure that we keep our family safe, our community safe. If I take you back to March 7th was a Saturday night where I was reading the newspaper on Friday and over Saturday, over Shabbat, and I pulled some of the doctors together at the end of Saturday night services, and I said, there's this COVID thing coming, and we don't really know so much about it, but I think we should have a committee to kind of think about, should we be doing Purim the same way we were? What we should be doing next week? Should we? And one of the doctors said, it's just like the flu. Don't worry about it. I said, I really think we should meet. And we met and we began to develop protocols. And as we developed protocols, day by day, they became outdated.
Oh, okay.
Day by day, they became outdated as new information came about. We were preparing for our 50th anniversary. And I remember talking to Andrea as our dinners were close proximity to each other. Are we going to have our dinner? Are we not going to have our dinner? And then just 7 days later, it was clear to us that not only were we not going to have our dinner, not only were we not going to serve anything at Kiddush, but for the first time in 50 years, we were going to close our building. We were going to suspend services that we have 3 times a day, every day, 365 days a year. And it was, an incredible moment, which was, for me, was a very special moment of partnership between the professional and the lay leadership in our community, and really synagogues and institutions across town. And what I was saying then, and I think it's all the more true now, is to really reframe the conversation from cancellations and closures to a positive discussion and focus on public health, personal health, public responsibility, making sure that we do whatever we can to protect our own personal health and what we need to care for the community within our walls and beyond, to make sure that everyone was safe around our community, around the country, around the globe. And for me, that was such an important Jewish value that guided so much of our conversation, so much of our actions and our reactions. So what did that mean? So you asked me in the email in describing this to think about some of the challenges we faced, some of the rabbinic leadership, and some of the larger trends. So what are some of the challenges we face? Community, connection, spiritual nourishment, those are things that people get within the walls of synagogue. In our community, not so many years ago, we did a study called JMAP. Of the respondents, the most important organization that was identified was synagogue. Over 87% of people identified that as the most important thing in our community. For all of these reasons, community, synagogue, ritual connection, communal connection helps make sense in a difficult world, helps make meaning when the waves seem to get just up to our head. It's an anchor in a stormy port. And COVID became a time where we had to rethink how we engage. How do we create that community in a virtual manner? How do we create that community when just bringing people in proximity, which is so special and so hard to replace, itself could potentially be so deadly and so dangerous? And the other question that I think it really called into question for us is that as a Jewish community, we've been blessed to live lives of abundance, both materialistically, but also philosophically. We live in a world of and. You can be devoted, ritually connected, care about every dictate in the Code of Jewish Law, and still enjoy, 5-star gourmet, kosher, glatt kosher safaris in Africa, right? They're not mutually exclusive. And what happens in a world where there isn't enough room for everything we value? How do we start thinking about that, even if just for a little bit, there isn't enough room for everything? How do we engage? What does that mean? Who are we as people? What do we focus on? What are those priorities? How do we engage Passover when we're not able to be with all of our family and all of our friends in the same settings? What do our high holidays look like, or life cycles? How do we grieve? How do we celebrate? How do we do all of those things when we're not able to rely on everything that made our life so rich and so abundant? And that really became the challenge of the hour for the rabbinic community in many ways. And what it pushed rabbis to be were innovators. If you had had this panel a year ago, we've been talking about how rabbis have become experts in physical security. Now we all seemingly have, an on-the-job NPH, Masters of Public Health, right? How do we become technological gurus and long-distance tech support for people who aren't necessarily connected on Zoom across our community? Amping up both our pastoral responsibilities, our spiritual guidance, as well as our creative hackles, for lack of a better term, to make sure that we can address all the different situations. And so I think in that, solutions came, at least for me and many of my colleagues, by thinking about what are the goals we wanted to create, what are those core responsibilities that we want to make sure that we always try to inculcate, and how do we find new ways to reach them, both despite of the situation, but also empowered by the situation. If we're teaching over Zoom, how do we use the platform to our advantage, as opposed to just shoehorning whatever we were doing before on Zoom? what are other mediums that we connect? What are other things that we could never do if it weren't for the current reality? I'll give one example. We brought a group of 54 women to share 1 minute on every parsha in the entire Torah. You can never do that program quickly in real life. Just the time to get up, walk to a podium, and come back would take 4 hours. But if you do it on Zoom, it's unbelievable. You're able to connect people, and by a click of a button, one person speaks, flows into the next, into the next. It was a transformative, powerful event for everyone who participated and everyone who shared. Alternative programs, new settings, high holidays. High holidays is probably the most interesting challenge of late. How do you manage to service and create and recreate what is so special and magical about the high holidays in a reality like this? Whether people went online and therefore people were able to connect to much wider audiences than they ever have before, whether they made things shorter and they're able to do more in waves, which we found not only was more accessible to many people, but enabled more people to partake because people have different family obligations. And if we're running 3 services, one starting at 6:30, one starting at 9:30, and one starting at closer to noon, so one spouse could go to one and one spouse could go to the other. And for the first time, they both could have a meaningful spiritual high holiday experience without having to worry and juggle, well, who's going to be with our children at this point or that point. I could go on for a long time, but I want to just talk about some of the broader trends. And I'll invite any questions. If people have questions, feel free to put them in the chat so we don't forget them, and then we can come back to them at the end of the evening. What are some of the larger trends? Number one, on the synagogue level, I think membership is something that we will see is increasingly more visible, increasingly more appreciated in a post-COVID-19 world. There was a survey done by someone in our community on the national level that saw this. But the reality is that being on someone's membership list meant something now. Your gym wasn't calling to check in if you had food, if you were doing okay. Your synagogue was. And I think particularly as we look at a generation of people who notoriously, perhaps undeservingly, were pegged at people who didn't want to affiliate, I do think that this changed the conversation about what it means to affiliate. Not should I or should I not, but how do I affiliate in a meaningful way that I get where I have that engagement. Zoom is here to stay, right? We will be having meetings on Zoom. We are connecting more people during Zoom. The question we have to ask ourselves is how meaningful are the engagements on Zoom? And I don't mean to call anyone out here, but how many screens are lit where people are really engaging, and how much of this is almost a podcast that you can listen to later? And again, I do the same when I'm not speaking, so I'm just as guilty. But I think it's something to think about how we use Zoom, but how do we make sure that we have real engagement and not just create a Zoom TV channel with content the best that we can. I think lastly, COVID-19 was an accelerant. It pushed to the forward things that were already simmering. In people's personal lives, if there were challenges, struggles, financially, domestically, with children, with parents, this just accelerated it and made it much stronger. Organizations that had created a culture of collaboration collaborated more. Organizations that couldn't collaborate still don't collaborate. Organizations that struggle to execute still struggle to execute, just in much broader ways. And organizations that were able to rapidly execute and deploy new ideas and be nimble and adaptive were able to show that in great stride. And you know, Andrea's about to speak. I think the Solomon Schechter School is a great example of that, of how they were able to be nimble, but that didn't happen in one night. That's years of developing a system that is, you know, extremely talented at what they do, and how they operate and how they provide education on every level. The last piece, and I don't want to steal too much of Katie's thunder, is mental health. I think, at least in the Orthodox community, we've always talked about mental health, but the recognition that mental health is just as serious as a physical element is something that has become true, in reinforced in religious circles in the strongest way possible. I sent an email to my community that I will carry my phone on Shabbat, on Yom Tov, on festivals, days where I never use my phone. We don't check email. I'm not on Instagram or Facebook or anything. And I invited people who were alone and isolated to call me, that they should reach out to me. And I didn't do that on my own. I'm not this, innovative, clever, person who did it on my own. The people who trained me at Yeshiva University, the people who write religious responsa for a generation, are training a new generation of people to treat mental illness as the same as a physical ailment, and to give the same responsibility to treating that with the same halachic and Jewish law weight that a physical ailment has, which I think we always knew were the case. But this has created an environment where we're able to really pronounce that and see that sea change across the Jewish community. Homelessness, food insecurity are all things that I think COVID-19 has raised the awareness of. It was always there, but now we can appreciate it more. And perhaps it's a little bit more clear in our community how important it is that we band together to combat that and to make sure that we're on the right side of ensuring that everyone is safe. And the last thing, on a positive note, growth. Our community has been growing, thank God, in the last couple of years. And again, sorry to steal your thunder, David. But Hartford is a destination now. The New York Times, I've gotten call after call from families looking to get out of the city to find a community which is vibrant, that they matter, and that they can live comfortably in. And West Hartford is that community. And it's unbelievable. And I think that was always the case, but COVID-19 is drastically accelerating that as well.
Thank you so much, Rabbi Brander. I'm going to pass it. There's a pretty good segue there for Katie Hanley, who is the director of the Jewish Family Services, and she's also someone who took on a new job in the middle of all of these changes going on. And we wanted to ask her to speak a little bit about how Family Services has responded in terms of providing direct services during this time.
Thank you, Elizabeth. It's really wonderful to be here with everybody. One thing that I'm definitely missing out on and being new in this position during COVID is getting to meet a whole lot of you in person. And so that's definitely something that I'm missing, but getting together when we can in Zoom is nice too. So I'm really happy to be invited to be a part of this, and thank you. So I started at Jewish Family Services of Greater Hartford on June 29th, and that was after a what I've called a Zoom-tastic job interview process, which I don't know how many of you have had a start to finish job interview process via Zoom. The first time I walked into the office was on my first day. But honestly, it was an easy decision to make when I was offered the job, because of the dedicated board, the way that they had handled and continued the search process. And Danaher, who was leading JFS for over 30 years, was retiring, and they didn't put it off. They in fact stayed on schedule, and I think that really says a lot about a board that cares about an organization and wants to move forward and is very hands-on, and wants to make sure that the services are rendered and that the staff is cared for and that there's a leader in place at a very critical time. That being said, a lot of the changes related to COVID happened when I wasn't there, but as far as I know and have learned since I've been here is that quickly JFS moved towards a telehealth model for therapy, which meant they shut down the offices to make sure all of the staff were safe and social distanced. All of the therapists started doing their appointments via Zoom. So the team had to quickly operationalize that, had to get, HIPAA compliant Zoom accounts, and make sure that we had all of the billing codes for teletherapy. And it's quite a big ordeal to change from, an in-person outpatient clinic to doing all of that via Zoom. JFS did it. And of course, we lost some appointments, from the start of the time to when we started to like really people were like, okay, I can do therapy via Zoom. And some people it doesn't work for them. They may not be comfortable with the technology. They may not trust the technology. In those cases, we do whatever we can. We have certainly had therapy sessions over the phone versus having, a camera. And so it really has been the therapist doing everything they can to stay engaged with the clients. That being said, I know that everybody here is, Zooming in from home, and all the distractions that are happening behind you. Now, I would encourage you to think for a moment what it's like doing therapy with somebody when your child is running around behind you, or somebody's yelling for you downstairs, or your dog won't stop barking. So I would say that our therapists are probably carrying a very heavy burden for JFS at this time. It's very hard to go through a pandemic and be present and give your clients all of the reassurance that they need, but also be living through it yourself. I saw the other day a great statement, which was, just because somebody can carry it well doesn't mean it's not difficult. And I think of that when I think of the therapists, because it's very hard to work with people and be present during this time. One part of the services that didn't really change was, as many of you know, Jewish Family Services has a care at home program. So we have approximately 40 seniors who are living in their homes, and we provide caregiving for them. Very tough business to be in right now. You're talking about the most vulnerable population. You're talking about frontline workers working with the most vulnerable population. It's really hard to do social distancing. It's incredibly important to have the proper personal protective equipment, and all of that PPE costs a whole lot of money. And as everybody can imagine, that's a whole lot of money that wasn't budgeted for, but is essential to the health and well-being of the clients, and also our caregivers, which we couldn't work without. And then the leaders, the managers at JFS who are listening to their staff every day, making sure that they're thinking of all of these things. Doctor, you were saying before that you were just kind of overwhelmed with the amount of news that you were taking in. And I think that, as a manager and as a leader at a nonprofit organization doing direct care at this time, it's that, and then trying to integrate that into, how do I get this into a policy? How do I make this a practice? How do I make sure everybody knows what the latest information is? How do I make sure I have the right information? I heard this over here, but it's written over here this other way. It can be quite exhausting. And then the need never stops. And in fact, it has increased. So one of our programs is the Anya Rosenberg Kosher Food Pantry, which has, up until COVID start, been a choice pantry, which means people would come in to the building and, on their own time, leisurely take a look at the food that we have and take what they need. Obviously that couldn't happen anymore. And so we had to very quickly change gears and very quickly adapt to the fact that people maybe couldn't leave their house. And so thank goodness, with some wonderful partnerships in the community, which I am so impressed by as a new person to the community, partnerships with the Jewish Federation and the Jewish Community Foundation. We were able to get meals to people in their homes. We were able to change our kosher food pantry to a contactless curbside pickup, which is still happening today. So, April through now, 2 times a month, people, if you come to the parking lot there, you'll see a line of cars, and people will drive up, and one at a time we'll get them their bags. and again, this couldn't have happened without the board of directors at Jewish Family Services, who kind of stepped up and did what it took to get these people what they needed to. And, you know, really not just handing out the food, but being present and greeting somebody and kind of seeing how they're doing, you know, and really listening to them. You know, so they're, and then adapting the food that we were giving them based on what their needs is. For instance, there may have been somebody who was living in a hotel, so we're not going to give them the food that you would need, you know, a stovetop to prepare or something like that. So they would adapt the food based on the client. And so that continues today. And it's a wonderful way to build community, to get to know somebody and their needs and to be able to feed them. And then as the team was feeding people, they were realizing, you know, how are these people going to get clothes for their kids when school starts, or, you know, as the summer comes around, if they need some items for summer, or then when the fall comes, if they need some items for fall. So thankfully, you know, being under the JFS umbrella is Tara's Closet, which was founded exactly for that purpose, is to be able to give people who are in need clothing with dignity and support them as a whole person with all of their needs. And so we started, thank you to Tara's Closet, started giving out $50 gift cards to Walmart along with the grocery bag, so that it wasn't, you weren't just coming to get grocery bags, but you were coming, you had a gift card, which hopefully gave some people a little bit of hope that they could go shopping for the things that they needed. And so that continues. We look at partnerships with Tara's Closet to get things we need. We did a back to school drive, so we were able to give parents a gift card to get those school supplies, which is a whole new perspective, school. In COVID, which, you know, I won't go too much into that because I know Andrea will, but we are seeing how stressful that is for parents, and we are seeing how people are not able to keep their jobs because the way that schools are running now, and that is impacting a whole lot of people. It's impacting a whole lot of women. So we're seeing disparities there, and that's a concern for us. We are continuing to do our JETS program, which is, you know, a job networking program that helps people who are unemployed network and hopefully get some tips on how to find a new job. All of that has gone virtual. So that continues to be run by Judy Rosenthal, who is amazingly charging forward in this Zoom environment that we're in, and it seems to be going really well. The last meeting that I popped in at, there was over 100 people. And so I think that's another trend that we're going to see continue, is how can we help all of these people who are impacted by the economy since COVID hit? How can we help them position themselves, get them whatever they need to get out and get a job? And so that's another program that is extremely important. The other programs that we run haven't have been strained by COVID, but still continue. For example, we have a basic needs program, which is a TANF program for it's temporary assistance for needy families is the acronym. We also have a program for victims of crime. So we have case managers who are in touch with people to make sure they have what they need. Obviously, a very hard time, you know, compounded by COVID. We have a Holocaust survivors program. And for many of you who don't know, many of the Holocaust survivors that that are on our caseload live at or below the poverty line. And so when a pandemic hits and somebody is older and living in their home and they don't have much money, and it's hard for them to maybe set up an Instagram account to get food delivered to them. So that's, for example, something that we were able to do. The Eversource had an incredible rate hike this summer, which majorly impacts people who are income limited, and that can really affect somebody who is aging in their home, and to not be able to have a cool air could be very dangerous. So there's all of these pieces that are compounded by COVID, and the health disparities. People without access to healthcare are impacted by COVID differently, and people who may not have access to the technology for their children to do distance learning, for themselves to do distance learning, or have the child care for the children to go to school. And then you put on top of that the political strain and the racial tensions, which were always there. And I think that now it's certainly a good time to be talking about it, because it's in our face. We can't not talk about it. But something that's clear to me, being a part of JFS, is that all of this is a part of how our community is impacted by COVID. And so to talk about one without talking about the other things is missing out on a chance for us to learn, and a chance for us to really get the full scope of the problem right now, so that as Rabbi Brander said, when we're in the off season and we can kind of take stock of what happened, then because if we're only focusing on COVID, it's just not bringing the full picture to us. So I don't know. I think maybe I went off on a little bit of a tangent, but maybe that gives you a little bit of sense of what it's like, working in a nonprofit that focuses on basic needs at a time during a global pandemic and racial strife and political unrest and all of those things that probably keep you up at night. And it's true for everybody we're working for. And I just want to say that the social isolation piece is really huge. It's big for it's really big for mental health. It's really big for seniors. And I think that those were always a problem, but they're worse now. And then on top of that too, I just want to mention to you all, in case you wanted some reassurance, anxiety is contagious. And so, if we're around people that are anxious, which most people are, you can feel that. And if you were already predisposed to that, or you're struggling with something else, it can really exacerbate things. So you have my permission right now to just acknowledge it's okay to, it's totally reasonable that we are all very anxious right now. And if you need help, or if somebody needs help, we're here for you. And there's a community of people that can help you. And I love this panel tonight because I think it was brilliant to bring together all the different facets of the community, because it isn't just one place that you can go in this community. There's a whole lot of people that you can reach out to. And if that one person doesn't have the answer, they know somebody who may. So if any of you have questions, I would love to hear them later, or suggestions for us about how we can better serve the community or make our services known to the community. I would greatly appreciate that. And I'll end there, but with the caveat that I certainly could not say enough about all the people that have been making this successful. And I'm sorry to not be able to name everybody or name every sponsor we've had, but honestly, we're taking it day by day and doing the best we can. So I'll leave it at that. Thank you.
Thank you, Katie. I think that gives us a big picture of what this looks like and how it touches people's lives in so many different ways. So our next speaker is going to be Andrea Casper from Solomon Schechter Day School, and speaking from the perspective of leading a school through this period of time. Andrea?
Hello, good evening, everyone. Thank you for having me on this panel. so much has been said that I think is really shared across leadership. But I think for these purposes, I want to go back a little bit, probably to February, because I have to say I feel right now like maybe I did in February. So I think really, really early on, this was on my radar. I was watching it closely. I have a father-in-law who's an infectious disease researcher at Harvard, so I was very quickly cued into what was happening there in those developments. And honestly, I was watching that more carefully than a lot of other areas, because as schools, waiting to see what would happen, it was clear that the universities were actually leading the way. And because there seemed to be so much lack of clarity and information coming from the national level, I felt like, well, I will look to the medical specialists. And Dr. Fauci is a friend of my father-in-law, so like he is a name in our house and has been since February. We worked with a small group within the school. We sort of had this like COVID response team that we met every day for 10 minutes. Just to like, what have you heard? What do we know? What are you reading? What do you see? I also am very fortunate to have a great relationship with Tom Moore, who's the superintendent of West Hartford Public Schools. So I was very quickly also sort of in touch with him to know. I do want to sort of frame all of this with Rabbi Brander talking about like whatever it is accelerated, and all of the things, whatever sort of habits and of mind and of heart and of interpersonal relationships that were there paid, not because you do it for utilitarian reasons, but they really, really paid out forward in this situation. So just a quick little story. I was actually in near Stores at UConn meeting with a woman who I was asking to join our board. And as I left lunch with her, I got into the car and I got the call from Tom Moore saying, all right, it's happening. We're shutting down. I'm giving you the heads up. My email is coming out, at 2:40. I think it was 1 o'clock. And it felt like a situation room, right? Where I'd had the beginning of a letter already prepared. I called the school. I had to have the communications person like, are you alone? Can nobody hear you? This is what's happening. I'm pulling in at 2 o'clock. His email's going out at 2:30. Ours is going out at 2:40. Like, we have to have this like very, very tightly coordinated because we're so intertwined, our families, with our school and of course the public school system. And I would say probably 2 weeks before that, as I was paying attention to some things, I started putting together also the communication and getting the faculty to think about, what does distance learning look like? What do we need to have in place? And after the closure, one of them said, we couldn't figure out why you were pushing us so hard on this thing, that all of a sudden happened. And it was clear to all of us, two things, or maybe three things, had to be true. We had to launch the distance learning immediately. There could be no gap of time. And it was felt that urgent to us and to me, because I knew we were going into some sort of isolation, and the children had to feel a continuous connection to their classmates and to their teachers, right? So that was top of mind. And I knew the families needed to have as much routine in place as quickly as possible so things don't sort of begin to fall apart in the transition. And then the education, like, fine, but that was like a distant third, right? Like, there were these other things that had to be put in place. And to their incredible, I just can't say enough about the faculty. They found out, 5 minutes before the families, it was on a Thursday, that we were closing at the end of the day on Friday. They got everything together. We had new technology rolled out. We had a whole schedule rolled out. And Monday morning at 8:30, every single one of our students was engaged, even our 2, 3, and 4-year-olds, in a whole system. And then very quickly, we saw which things needed tweaking, that we needed more on live interactions for the students that weren't in that place. And I think the thing that sustained us through a lot of intensity and a lot of change was that our families very, very quickly acknowledged and appreciated the faculty, really vocally, really openly. After the first week, they made deliveries of wine to all the faculty and staff. The following week, the board did this, you know, sent chalot to everybody. There was a lot of very quick, positive, appreciative feedback. And I think, again, that sense of accelerating our sense of community and connectivity, and that we're just going to do everything we have to do to get through this is what we'll do. And what I think a lot of humans are really well prepared to do, right? You get sort of hyper focused in a crisis. And there was a laser focus on what needed to be done and keeping things together for the children, who are our first primary concern. And then of course their family systems, because even at school, it's true. And now they were embedded in their family systems at the same time that we were engaging with them. So we got through. There were obviously disappointments for children and families about the Israel trip and graduation. And it was interesting trying to hold space. I will say I was a little bit challenged and had to really find the space for people to feel that disappointment, because I felt like, you know, we're in a pandemic, right? With all love and due respect, it's a graduation. It's a trip to Israel among whatever future trips. And people are dying, right? So the level of disappointments people are feeling are huge. And on one hand, I really wanted to honor, but I also really felt it was important to provide the perspective that it's not all equal. The disappointments and the pain and the loss are not all the same. And I do think that's important. We think a lot about building resilience among the children at our school. And I think that was a big piece for us as we tried to communicate around it. Of course, nothing but education was in the news. I think from the end of the school year, continues today. What happens? How do schools open? Will they reopen? We created a large pandemic response team with 5 subcommittees: health and safety, mental health, teaching and learning, I'm gonna probably forget, communication, and facilities. And that was also fascinating and incredible work by everybody who was in there. We had a very specific goal in mind, and that was to put out 2 new safe reopening handbooks. One that was internal for the faculty and staff, and one that was for the students and the children. We're looking at literature as it is being published. We were really, really clear to stay with peer-reviewed literature on anything health and safety. And we did have, that was a medical team that was doing that. We were able to stick, before August 1st, we had our full handbooks out, with the caveat that everything is changing constantly, right? So I put it out, and in 5 days, I'm gonna put something else out again that's gonna be updated, and a new policy and a new piece that's working. And then we really put I like to say that we're scrappy. We don't have a lot of resources, but we make a lot happen. And I was very, very committed to setting up outdoor classrooms, particularly focused on the health and safety of our faculty and staff in terms of where infections rate was going. And so we've done it. It's been a huge amount, literally, of physical labor to do it. Our middle school is outside 100% of their day, unless it's raining like the last 2 days. But that's the little silver lining to a drought earlier since school started. And we continue. We haven't had any cases in our school. By the way, I don't think that's because of us, but I think we've done a particularly good job of maintaining our protocols and not easing up on them at all. And there were things that were huge shifts. You know, the first day, no parent is allowed in our building. We health screen every faculty member and every child before they come in, personally, me and a few other people. So we would have 8 2-year-olds dropped off on the first day of school. No parent, and our 3 and 4-year-olds, right? It doesn't stop there. It was the most successful drop-off we've ever had. We had 1 child in the entire school cry. it was those are the silver linings of things like, oh, what are we doing that make this more challenging for kids versus better for kids? So there's a lot that I think will stay in education in a broader sense that if there are questions about, I'm happy to give my thoughts on. And I really hope in the local sense, continuing to learn outside as much as possible. We've never had a student body so calm, ever, right? They're just calmer. While I've always greeted every child who's come into this school, we now as a team greet every child, every faculty and staff member, and say hello to every parent. That has given us a really good sense of what is happening in the community. And also just literally we get to lay our eyes on every person and get a sense of how they're doing, especially when mental health it's such a high priority for us, and trying to just scan that landscape. And yeah, and the fact that our kids can stay connected no matter what, I think is a fantastic result that I hope will continue.
Thank you so much, Andrea. That's wonderful. I'm feeling like this panel needed to go on for another few hours, but our final speaker is David Warren, who is president and CEO of the Jewish Federation of Greater Hartford, and the man who sort of helped pull everyone together and help navigate our way through this. So David.
Thanks, Elizabeth. And you know, I feel, to pick up on the sports metaphor, Rabbi, that we're like perhaps in the fourth or fifth inning. And it's so wise to have paused, that we're pausing now to do this and record this. I look forward to being here for the post-game interview.
Do we all?
Soon, hopefully. I know we're running a little late, so I'll try to go very quickly, but I really just want to give a shout out first to all of my fellow panelists whose jobs are so difficult in normal times and have really been, along with your staff and Rabbi Brando with the other rabbis in the community, really have been heroic in the work with all of the mental health issues and all of the personal issues and the family issues and our own children's issues. You've done extraordinary work. So there was a headline yesterday in the Times of Israel, or a quote in an article from President Rivlin, and the quote was, and I'm not sure, maybe this wasn't the greatest translation from Hebrew, "The air is full of gunpowder," right? He was describing explosive tensions in the air in Israel around COVID-19, its impact on the economy, on government protests, the social disruption, on school-related issues. David Brooks, I've mentioned this quote in the past. David Brooks, back in March, wrote in the New York Times, "Some disasters like hurricanes and earthquakes can bring people together, but if history is any judge, pandemics generally drive them apart. These are crises in which social distancing is a virtue. Dread overwhelms the normal bonds of human affection." And yet in this community, and we're certainly seeing, not just in Israel with gunpowder in the air, we're seeing that in our country as well, in many communities, in many ways, manifest around social justice issues and economic and political issues as well. And yet, without being too cliched, I think an overarching takeaway in our community, in many ways, is that this crisis has actually brought us closer together. In many cases, purposefully so. Andrea, the way that you've described your community and the purposeful ways in which you fostered strength in community, and Rabbi Brander and Katie, and the great work, Anat, that you've been doing. And then also sort of de facto, some of the unanticipated benefits of Zoom, right? We're all a little fatigued, including me trying to work with my progressive glasses to get the right focus here. It's not working, but it really has brought us in many ways closer together and enabled us to do things. But I would say most importantly, it really rests on the leadership, again, around here, around this Zoom room, and across our community, that I think has enabled us to become closer together. And just a few examples of that in terms of what Federation has done and Foundation, and then a couple of sort of lessons and initiatives going forward. And then again, happy to stay for a little while for questions. So that sort of collaboration, nowhere better manifest, and I see Gail and Catherine, at the risk of leaving others out from the Foundation, nowhere better manifest than the really close collaboration between the Federation and the Foundation. And again, like all of you have described, back in early March, we literally pivoted and our staff dropped almost everything else they were doing to focus on urgent social service needs. Katie, with your team and with others, and really within a matter of days, we're working to deliver meals, outreach to those in need, and then begin the task with the Foundation of raising resources to provide sustained need, both food insecurity, counseling, as well as institutional need. One of the challenges, I think probably, organizationally on this call, that we looked at in federations and communities around the country, can we keep raising money, right? So the roles of federation, the role of federation is multifaceted. Convener, planner, lead voice. But of course, part of that is to try, along with the foundation, to provide the resources to help sustain the day schools, JFS, now in some ways through the Rapid Relief Fund, some relief for the synagogues. And we had a real question about, could we do it? And in fact, what we found here and in much of the country is that our communities are reaching even deeper with the appropriate vision to meet those needs. So as we've talked about in other fora, together we raised almost $1 million for both initial relief as well as some sustained recovery resources for institutions. And our campaign at the Federation, sort of unbelievably to us, closed at about the same level as the prior year. So in essence, with the Rapid Relief Fund, the community raised almost $1 million more than the previous year to meet those needs, which really says a lot about this community and the resources. And then we also, have been really focused on the convener role, initially around strategic issues, around PPP, accessing of funds, and PPE, all of these acronyms. We have a session coming up on Thursday for community leaders with JFNA and SCAN on security, particularly around the election coming up. So we've really been focusing very much on a convening role as well. More to say, but I just want to shift a little bit to long-term. It's a little bit, insensitive to say lemons to lemonade. There's no lemonade. It's hard to point to sweetness out of crisis. And this has been a bitter crisis for so many, but every organization has had to look at the areas in which transformation is required, and also opportunity. And so in the Federation specifically, there have been a few points of very focused change and opportunity, some of them quite nascent, but important. I'll just point out a few. One is going back to rapid relief. So part of the monies that have been raised, and I saw Rona Golub on this call, and Ann and Jeremy Pava played a role, Alan and Barbara Rosenberg, in providing an initial fund for what we're now calling a Jewish free loan fund, classically a Hebrew free loan fund. I don't know that many of us call ourselves Hebrews anymore, so we've taken the radical step of calling it a Jewish free loan fund. But this will be a binyan adei ad, a lasting house, an edifice, an institution that will survive COVID-19, will be able to meet financial needs now for people, for families and small businesses, but will be a sustained fund that will grow into the future. Rabbi mentioned Destination Hartford. There are many people, not least of which Rabbi Brander, who really get credit for the innovation around this, and he's been a leader, not waiting for the Federation and others to really begin to draw upon the desire of people in other communities to consider relocating. And Federation is now taking meaningful steps to support that with institutions across the region. And I would also highlight Education Reboot, for lack of a better name, but in all of this, in this time of dislocation, in some cases of cessation of activities, we believe it's an opportunity to innovate. Particularly, we have great day schools, and we have a lot of meaningful effort around around education outside of a day school context, meaning Hebrew schools. But I think all would agree there's a lot of opportunity to do even better. And so we're bringing together a very focused effort to identify and hopefully be able to implement best practices. A number I've been citing for the last year out of JMAP, Rabbi Brander, you mentioned, is the diminution in Hebrew school participation from roughly 2,000 2 decades ago to less than 800 pre-COVID. So it's a crisis, and we have to use this opportunity now to figure out how we make it a win-win for everybody across the community in reimagining Jewish education. And I would also say, really focusing in light of the broader turmoil, the broader tensions in our community, much of it focused or manifest with bigotry, rising anti-Semitism, rising racism, that we're actually doubling down on our community relations focus. Again, very purposefully working with others to build bridges of understanding and foster a more inclusive community across Greater Hartford. And then finally, literally today, working with our foundation colleagues, we'll be working to formulate potentially a new effort, new strategic effort to define and support strategic needs in our community. So more to say about that in coming weeks. I'll just close by saying, you know, there are obviously exogenous factors that we can't control. We can't control the economy. We can't control the virus. We can control some of our response, but we can't control the virus. We can't control the political turmoil and some of the anxiety that's engendering. Of course, what we can and must do is to ensure that we and each of us, each of our organizations in the community, has a clear vision of requisite impact. And that, again, you know, this crisis is bringing to the fore the need to have laser sharp focus on the impact that each organization has and the needs that they're meeting. And then, of course, be able to marshal the necessary resources to support and sustain those needs, to support and sustain the vital institutions in this community, much of which you've heard about today. So I'll just finish, Acharon, Elizabeth, with this quote, again from David Brooks, from another article where he was speaking of Viktor Frankl, the Holocaust survivor, and his writings after the Holocaust. And Frankl, and this is a paraphrase of Frankl, but Brooks, in citing Frankl, says that meaning in these times, in times like this, in times of crisis, comes from three things: the work we offer in times of crisis, the love we give, and our ability to display courage in the face of suffering.
Wow, thank you, David. That's a lot to think about. So I did ask if anybody had questions that they wanted panelists to comment on, and Catherine Gonnerman asked if you could pick one adaptation that we've made since COVID that you would like to keep after the pandemic, what would it be? So any panelists that would like to jump in on that?
I'll go. I think that the ability to have Zoom meetings is extremely efficient in many, many cases. And I think it means more people can participate in some cases. And so I think that, you know, certainly from the business perspective of, you know, paying for mileage or even just taking the time to drive 30 minutes to a meeting and then 30 minutes back, I think that people will be more comfortable to do virtual meetings, which hopefully will be more efficient for a lot of people.
Great, thank you.
I would not only echo that, but on a different track as well. And I don't have a full forensic analysis of like how and why this is happening. I have some hypotheses, but the lay professional relationship in organizations across the community, I think many would argue, and maybe this is a function, Rabbi, that those organizations that were already strong are stronger. But in general, I'm seeing it really across the community that the lay professional relationship has been stronger than ever. And people really have come together. They put aside the mishigas. They're focusing on what's important and really collaborating in extraordinary ways.
Maybe it's because they have something important to focus on. I would add, if there's one adaptation, and I say this as a father who on a school night has spent an hour and 13 minutes now on this program, the family time that so many of us got during the shutdown part, and the recognition of those simple things are something I think is something really special, and something I think we as a community in terms of Jewish values need to find better ways to promote, endorse, and fortify.
Thank you. Anyone else want to chime in on that or with any other questions for our panelists? I know we're a little bit over time, so.
I don't have a question. I just have a comment and a suggestion. I found by chance about this program from Facebook. I think that it's a very important program, and my hope is that it was recorded and could be made available, and the information could be disseminated about the link through the synagogues so they can email the congregations and make them aware and prompt them to view the program.
Thank you very much. Yes, it is being
it's
recorded, and we will put it up on our website. So we'll hope that it will be disseminated broadly, and we would love to have help from the whole community in that. And I think really a lot of the questions that have, so many things that have come up tonight really bear a lot of more discussion. So as we go forward, maybe we can come back to it. Thank you.
Yes, and that should also include people from the community, not necessarily from organizations, but just to hear how people cope with the whole situation, and how they strive to maintain their Jewish traditions and rituals and connecting with the Jewish organizations. And I would like a special shout out from one physician to another to Anat. Thank you for sharing your professional and emotional experience through this pandemic.
Thank you very much. Speaking of tradition, Rabbi Brander had received a question that maybe you'd like to speak to briefly about whether
Sure.
to COVID is more of an interruption to tradition or perhaps a creation of new kinds of traditions.
Right. So the question was, do you see your responses to COVID-19 as an interruption to tradition or creation of new tradition? So I don't know if the person's still on, but I'll take door number 3. I think it's an embrace of a tradition of innovation. If you close your eyes and listen to this description of the high holidays, where different seats were left separate, that there was someone at the door guarding to make sure that everyone met the health requirements, that in order to make sure that everyone in the community could come, that they actually did, because of small spaces, they did a raffle, and if you came one day, you couldn't come the next day, right? You would think you'd be reading the playbook of so many synagogues around town. What I just shared with you is just an English translation of the 1831 edict in Poland by Rabbi Akiva Eger, who was one of the leading halachist Jewish thinkers of his time, of what to do in the cholera outbreak in 1831 for the high holidays. And there's such a rich tradition of how we manage in these moments of difficulty. What do you do when you can't have people crowd around the Torah for Torah service? Well, that's actually already codified in the Code of Jewish Law from the 1500s. So there's such a rich tradition. I think it's thinking about and how we apply that. The message is always the same. The medium, how we communicate that message, will change from year to year. So I think that's my answer in a nutshell. I do just want to correct, because this is a historical record. I checked. We actually formed that committee. I was listening to Andrea's timeline, and I'm like, that makes more sense. We formed our committee the week before, not March 7th, but February 29th. And I have a strong recollection of running to Big Y to get toilet paper, and speaking to Andrea about, I think we're both going to cancel our events. when's the right time to announce that to people?
Thank you. The record stands corrected. Yeah, Andrea?
All right. Hi. I'm going to answer Rabbi's the question for him just with a little anecdote. So my daughter's ceremony of bat mitzvah was planned for the weekend after Memorial Day weekend. We were doing it in Minneapolis because my grandmother is still alive, and she did all of her study with my dad. And we decided to open our bubble with my parents who live in Massachusetts Memorial Day weekend. We had already, of course, canceled the travel to Minneapolis. And my dad is very, very involved in his minyan and usually is reading Torah every Shabbat morning, and everything had moved on to Zoom. And when we realized, oh, why don't we just come back? It's Shavuot. We have more, days off from school. We'd rather be here. And so I said, do you think it might be possible that my daughter Zelia could read Torah for your minyan next Shabbat? And he said, okay, I'll check with the rabbi. And they happened to be doing a joint service with another synagogue in the North Shore of Boston because it was Shavuot. And she said, yes, she can read this. And yes, my other two children could lead a Don Olam. She won't do the Haftarah, she'll just do this. And I've often struggled with what sort of happens with B'nai Mitzvot, and that it becomes the day all about the child, when I feel like nothing about that day is actually about the individual. It's only about community and about entering community. And and this was very sort of impromptu, so we let people know she's going to read, it's going to be Zoomed, it's going to be this if you want to be there. So a lot of people did decide to show up, and I thought there was nothing more sort of true to my feeling about the whole process of becoming and having the ceremony of bar mitzvah than her actually participating in two communities celebration and reading Torah for people she didn't know, Jewish communities at large, but nothing to do with her, and she simply was a contributor to a greater whole. And so for me, it ended up being the most perfect situation, where I don't think we would ever have had that opportunity to be truly true to like what it means to be part of community and contribute to community at large had COVID not happened.
Oh, thank you. We did have one question for Anat. Somebody wants to know what concerns you as we move into winter with COVID, and what advice would you give us all if you want to give us any advice?
Well, you could get probably better advice from listening to really, the experts like Andrea's father-in-law. But I can tell you sadly that we are seeing increasing numbers in the hospital, and this is just my view, but I'm not sure that this has been really reported, but the severity of illness is going up again too. And that for a while there, patients who were getting sick had really mild illnesses, because we were seeing it mainly in the 20-year-old cohort. And we're seeing more people, ICUs are starting to fill up again. So it is, a lot of us are feeling like, we're back, it's back. The second wave is definitely hitting us. So I would just say my advice is, to stay as vigilant as you were at the beginning, because it's very easy to kind of get kind of complacent. I do feel like if you do all the right things, and you can still maintain some connectedness, social connectedness with people, going outside for a walk, and being in contact that way with people, and not become overwhelmed again, like I did, for example, at the beginning. But remember to be vigilant, to start, come back to washing your hands again like you did at the beginning for 20 seconds, and do all of that, because it's coming back.
Thank you. And any final comments? I mean, I think what that puts us back to is all the adaptations and growth and adjustments that we have made individually and as families and as a community are going to be needed even more so in the coming months, it seems. The same person wanted to know what do we see as a future for living with COVID? It certainly seems like we're going to be living with it for a little while. So any of the panelists would like to give any final word on that, this would be a good time.
I don't know that I have major words of wisdom. I'm glad to see that the conversation in the media has shifted from short-term to long-term. I felt that at the beginning, the constant conversation that something was going to be over within a few months was actually really detrimental and had an impact on mental health because it wasn't actually preparing people to deal with what was coming. That's a conversation. And it's hard as a leader because you don't want to be seen sort of as pessimistic. I keep saying, I don't think I'm pessimistic. I'm being pragmatic and looking at the science. There's no indication, people used to even talk about, April 2021. And I kept thinking, what is happening in April 2021? We're in the same place. And so I think one of the most important things we can do is sort of help people make the choices, because I think you can't have it all right now. If school's important, bars stay closed, right? Like you have to make choices. We can't have everything. We have to decide what's important and do that and help people. I really think what we can do is help people understand that this is a long-term situation and the choices you have to be making are for the long term. They're not for this week and next week. And I don't know, somehow we have to hold people there and not let this drip into some sort of fantasy conversation about what's happening, in April 2021 or in June 2021.
Thank you.
I just want to echo that. I think that's so important. The decisions that were made, obviously we constantly have new information, but the passage of time alone is not a cure. And so, we've been outside the entire time for our services 3 times a day. Unfortunately, today it rained. We just returned our huge high holiday tent, so we had to cancel our service in the afternoon. But we did that because we felt it was a responsible, appropriate thing to do, to be outside and to wear masks. And just because we've been doing it for now several months doesn't mean it's any safer to go inside. And just because it's cold, that means we're struggling with what that means. But other factors don't make the danger any less. Obviously, we have to be smart. We have to learn how to gauge risk. And I think, for example, if we want to make sure our schools stay open, which are a backbone of our community, so there are other sacrifices we have to keep making for the long-term longevity of that. It's something that, as a synagogue, and I'm blessed with lay leadership, that's something that's so core to everything, all decisions that we're making.
Thank you.
I'll add one more thing too, is that I really liked what you had said, David. You'd said something, you said many wonderful things, but one thing that you said that struck me was that we were to, pay attention to areas where transformation is required. And I think that a lot of people have wanted to believe that COVID was going to be X amount of time before and after COVID. And I think that that's hindering us from really living and certainly doing business the way we need to as this goes on. And so I think that having that mindset of transformation through this will certainly help those of us who are leaders and have to make hard decisions and find ways to forge ahead and meet the need of the community. It helps to think of it not like we're missing out on something, but this is an opportunity to transform into what it needs to be.
Absolutely. Thank you. I think that's a great note to end upon. And I'd just like to say that that the Historical Society is very interested in continuing this conversation. If you have a story to tell or something you'd like to talk about your experience during COVID, please get in touch with us and we'd be happy to set up an interview with you. We'd like to do that on a broader basis as we continue to move through these months. And even though we're not in the off season yet, and it doesn't seem like we will be for some time, it's an opportunity to reflect on what we're experiencing, and as well as to document it for the future. So I just really like to extend a heartfelt thank you to all the panelists for giving their time tonight and giving such a wonderful view of the leadership that we're blessed with in this community, and everything that everyone has done to, to help us all as a society and a region through this period of time. So thank you all so much, and stay in touch.
Thank you.